Welcome back. Researchers will launch a trial to test an anti-COVID pill on younger children and teens. It's just one of the COVID headlines of the week.
Okay, so to break them all down for us is Dr. Lynn Jeffers joining us once again here, the Chief Medical Officer at Dignity St. John's Hospital. Good morning to you. Thanks for waking up so early with us this morning.
Good morning, Randy and John. Thanks for having me.
I want to start with Pfizer's announcement. We've been talking about it this past week. It's going to be testing its COVID treatment pill, Paxlovid, on young children. So what are the circumstances for kids to take this new medication? Because the American Academy of Pediatrics says a large majority of kids, they're asymptomatic with COVID, suffer mild like cold symptoms. So would this be for kids who might be suffering some serious underlying conditions or serious symptoms?
You know, we really won't know until we see the data and see what they come out as a recommendation. If they use the same criteria that they do for adults, it will be for people who have other issues or have a higher risk of having severe COVID. But even if it is effective, the question is going to be how much more effective, because like you said, kids are less likely to be hospitalized. So it's going to be harder for them to show that extra benefit. But if it is effective, it would be nice to have another option, another tool in your toolbox, so to speak. Because for kids who are 6 to 12 years old and who weigh less than 88 pounds, we really don't have that many options for this group of younger kids.
And Doctor, the Biden administration announced they've just started to launch the Test and Treat program. Can you talk about how that will work? It sounds like how you deal with the flu if you caught the flu.
At this time, I don't know that we know the specifics of how it's going to work, but the idea is that if you go to certain pharmacies or centers to get tested, and if you are positive, then there would have to be a physician or somebody legally able to prescribe medications on that site. And then at that point, you could get a prescription and get the medication right there. Now, in general, that might sound really convenient, but it may not be quite as straightforward as that sounds. The pills that are currently available for COVID have some limits. One of the pills has interactions with quite a lot of common medications that people take. And one of the pills may actually have some reproductive issues that shouldn't be used for pregnant women or breastfeeding women. So even if you know whether your medications interact with this pill, you might still need an expert opinion about whether that pill's right for you. So it's still best to talk to your doctor who knows you best if you can, who can help you weigh those benefits and the risks of taking that medication for your specific situation.
Yeah, that is good to know. And of course, so many people talking about the mask mandates that have been changing, in particular at a lot of schools in our area. Masks are going to be optional now for kids. So what's your advice for kids who might be going to school and have an autoimmune disease?
Well, the kids that are immunocompromised, I think about just masking in general. It's like checking the weather forecast to see whether you should bring an umbrella, right? I mean, what is the chance of rain out there today? Are you going to go inside or be outside? Who are you going to be with? And what are you going to be doing during that time? And how bad is it if you really get wet today? And so based on that, are you going to bring an umbrella today? And it's sort of the same thing with COVID. What are the chances of you getting COVID? Is there a lot of COVID infection right now in the community you're in or where you're going? Are you going to be inside or outside? Who are you going to be hanging out with? What are you going to be doing? And how bad is it for you if you get COVID? So depending on how you answer those questions, you will decide whether or not you want to bring your umbrella or wear your mask or not. And hey, if you just want to bring your umbrella just in case, no matter what the forecast, that's okay too. And same thing about masking. So I think from here on out, at any given place and time and day, some people will bring an umbrella no matter what the forecast, and some won't even bring it, even if it's pouring. So I think it's going to be similar with masks. You've got to weigh your own risk for your own specific situation.
Yeah, makes total sense. Common sense approach. If you're getting on an airplane with a lot of people, you probably want to bring a mask. Thank you, Dr. Jeffers. Important information. We certainly appreciate you taking the time this morning.
Thanks for having me. Stay safe out there.
Thank you. Have a great weekend. Okay, let's talk about that.